We all absolutely adore our pets, right? So when we see them hurting, our first instinct is to just make it stop. But that quick fix you might be eyeing in your own medicine cabinet, well, that could be a really tragic mistake. Let's get into why this is so important for keeping your pet safe.
So, just imagine it for a second. Your best friend, who's usually a ball of energy, is suddenly quiet, withdrawn, maybe even whimpering a little. You know they're in pain. And that protective instinct, it just kicks right in, doesn't it? You want to help them, and you want to do it now.
But here's the first hurdle. Our pets can't just tell us what's wrong. We have to become little detectives. And it's so important to realize how subtle these signs can be. It's not always a big, dramatic yelp. It might be them just licking one spot over and over again, or a sudden grumpiness when you try to pet them. These little changes, that's their way of screaming for help.
And in that moment, when you're desperate to give them some relief, a thought might pop into your head. A thought a lot of well-meaning people have. Hey, maybe I'll just give them a little bit of what I take for a headache. It feels logical. It feels like the kind thing to do. But this, right here, is one of the most dangerous assumptions you can make.
So let me be as clear as I possibly can be. The answer to that question is never. This isn't one of those, oh, just be careful with the dose situations. No, this is a hard, fast, absolute rule that could literally save your pet's life.
So let's talk about the why. For a dog, ibuprofen is basically poison. And I want you to understand how serious this is. A single tablet can be enough to do major damage, attacking their kidneys and stomach lining almost immediately. The results are just awful. We're talking vomiting, internal bleeding. It's a horrible emergency that is completely preventable.
Okay, so you might be thinking, well, what about paracetamol? That's different, right? This is where things get really specific, and it's such an important lesson in animal biology. For a medium-sized dog, yeah, it takes a pretty high dose to be toxic. But for a cat, it is absolutely fatal. A cat's body literally doesn't have the tools, the right proteins, to break it down. So even a tiny amount causes catastrophic damage to their liver and their blood.
And really, this quote just says it all, doesn't it? A dog, a cat, a human, we are all profoundly different on the inside. Our bodies process things in completely unique ways. And what's a helpful medication for you or me can be a deadly poison to them. It's just that simple.
So, if our own medicine cabinet is a total no-go zone, what's the right thing to do? Well, let's take a look at how the pros, the vets, handle it. And I'll tell you, it's a lot more thoughtful than just handing over a pill.
That's often used an approach called multimodal therapy, and that's a key concept to grasp. Instead of just relying on one drug to do all the work, they attack the pain from a bunch of different angles at once. Think of it like a team effort. They might combine different types of medications that work on different pain pathways, maybe alongside other things like physical therapy or even diet changes. It's a whole body approach, and it's way more effective.
All right, so let's peek inside the vet's pharmacy. This place is stocked with medications that have been specifically designed, tested, and approved just for animals. They're built for their bodies, which makes them not only safer, but way more effective than any human medicine could be.
And as you can see, vets have a whole range of tools to choose from. You've got opioids for really severe, sudden pain, steroids for certain kinds of inflammation, a whole toolkit. But the most common type of medication you're likely to come across is the first one on this list.
So what exactly are NSAIDs? You've probably heard the term for people, but there's a whole family of these drugs developed just for our pets. They are the real workhorses of veterinary pain management, especially for ongoing things like arthritis. Because they do two jobs at once. They fight the pain and the inflammation that's causing it.
You know, you might even recognize some of these brand names. If you've ever had a dog with arthritis, names like Meloxicam or Remidal probably sound familiar. The key thing to remember is that while they're in the same class as something like ibuprofen, they have been specifically formulated to be much safer for a dog's unique body chemistry.
Okay, so once your vet has figured out what's wrong and written a prescription, the ball is officially in your court. You become a super important part of the treatment team, and giving that medicine safely, that's your #1 job.
And here are 3 simple, non-negotiable rules for that. 1. Always give NSAIDs with food. This puts a protective lining in their stomach. 2. Be consistent. Same time every single day. This keeps a nice, steady, effective level of the medicine in their system. And 3. Be a watchdog. You know your pet better than anyone. And to help you be a good watchdog, just remember this easy acronym, BEST. B is for behavior changes, E is for eating less, S is for skin issues like redness, And T is for tummy troubles. Think tarry stool or vomiting. These are the big red flags you've got to watch out for. And if you see any of those BEST signs, the instructions are simple and immediate. Stop giving the medication and get on the phone to your vet. Don't wait and see. Side effects are pretty uncommon, but if they happen, they need to be handled right away.
So, we'd come full circle, right back to the single most important message of this whole explainer. It is a simple rule, but it's the one that protects the animal you love from accidental and sometimes devastating harm. Your vet is your partner in your pet's health. You gotta trust their expertise.
And that leaves us with one last thing to think about. The goal here isn't just to make the pain disappear, it's to do it safely and give them back their happy, full life. So, take a second and think about your own pet. Are you ready to spot those subtle signs of pain? And do you know for sure that the first and most important step isn't opening your medicine cabinet, but picking up the phone to call your vet?